Okay, I'm going to be talking about polycystic kidney disease. Polycystic kidney disease is a kidney disease that is an inherited disorder in which clusters or cysts develop primarily within your kidneys. These cysts are fluid-filled sacs containing water-like fluid that line the kidney walls. They may vary in size and shape and grow larger as fluid accumulates inside of them. One of the most common life-threatening genetic disorders. It doesn't matter your gender, your race, or your ethnicity. It affects everybody just the same. Cysts are the most common on the kidneys, but they may form on other organs like the liver or the pancreas. Diagnosing polycystic kidney disease, they can diagnose it by an ultrasound, a CT, an MRI, or genetic testing. It's more likely to happen to you if somebody in your family has it. The prognosis, there's no cure for it, but the course of the disease may slow with the control of the symptoms or get worse if you don't control your symptoms. Approximately 50% of patients with PKD progress to end-stage renal disease by the age of 60. Signs and symptoms of PKD are high blood pressure, back or side pain, blood in the urine, urinary frequency, headache, kidney stones, kidney infections, urinary tract infections, increase in abdomen size, or kidney failure. Complications of polycystic kidney disease include hypertension, which could cause further damage to your kidneys and increase your risk for heart disease and stroke. You could also develop a brain aneurysm due to the blood vessels being weak from the stress of the hypertension. This may also lead to a stroke or a brain bleed that could lead to more complications. You could also have a loss of kidney function. This may lead to the treatment of dialysis or a kidney transplant to prolong life. You could also have cysts not only just on your kidneys but as your liver. And a complication is liver, which it usually doesn't interfere with the function of the liver, but it may become infected and experience the abdominal bloating, swelling, and even jaundice. These cysts usually return to normal without intervention. However, in some cases, surgery may be required to drain the cyst. Interventions would just really be focused on controlling your signs and symptoms and preventing any complications. First off, you want to control your blood pressure. It's a main priority with PKD. You could use pharmacological methods like ACE inhibitors to bring that down. A healthy lifestyle is very important, including proper diet, exercise, and no smoking. Surgical interventions may be required to drain the cysts that cause obstruction to other organs or blood vessels. Prompt treatment of infections with antibiotics is priority to prevent the kidney damage along with fluids and adequate hydration. As the disease progresses to kidney failure and kidney lose ability to remove waste and extra fluids, dialysis may be needed or even a kidney transplant. Let me see how stupid I sound on this one. A nursing diagnosis for polycystic kidney disease would be ineffective renal tissue perfusion related to kidney malfunction as manifested by high blood pressure, blood in urine, kidney stones, back pain, and an increase in abdominal size. Here's an NCLEX question. Which intervention is most appropriate in providing care for an adult patient with newly diagnosed adult onset polycystic kidney disease? A. Help the patient cope with the rapid progression of the disease. B. Suggest genetic counseling resources for the children of the patient. C. Expect the patient to have polyuria and poor concentration ability of the kidneys. Or D. Implement appropriate measures of the patient's deafness and blindness in addition to the renal problems. And the answer would be B. Suggest genetic counseling for the resources of the children of the patient. The rationale is PKD is one of the most common genetic diseases. The adult form of PKD may range from a relatively mild disease to one that progresses to chronic kidney disease. Polyuria, deafness, and blindness are not associated with PKD. Another NCLEX question would be a 22-year-old female client has recently been diagnosed with PKD. The nurse has a series of discussions with the client that are intended to help the client adjust to the disorder. The nurse plans to include which item as part of one of the discussions? A. Ongoing fluid restriction. B. The need for genetic counseling. C. The risk of hypotensive episodes. Or D. Depression regarding massive edema. And the answer is B. The need for genetic counseling. It goes, along with the same with the other one. Adult polycystic kidney disease is a hereditary disorder in which it is inherited. Because of this, the client needs to have genetic testing.